Yes. Okay. Okay, so let's make sure that we can have the interpreters spotlight in and out. And it looks like that's working fine. I can see a case. So we're going to go ahead and get started. And before I turn it over to Susan Martin, who is joining us from the Department of Medical Assistance Services, she's the Senior Policy Analyst. She's going to go through with you some of the different eligibility criteria for the different Medicaid covered groups and the Medicare Savings Program. But before we do that, I just have a couple of announcements. We have both WISAs and VR staff on the line. So if you are a VR counselor, CRC credits are available for your participation today. If that's something that you need, you can shoot me an email after the training and I'll make sure those get logged in for you. I'll put my email address in the chat box. If you are a WISA who has received their Work Incentives Practitioner certification through Cornell, continuing ed credits are available for you for your participation today as well. You're all in listen only mode just to cut down on some of the background noise and minimize the distractions for the interpreters. If you do have a question, we ask that you put it in the chat box. We'll leave about 20 minutes at the end for questions and I'll read them aloud. This training also is going to be recorded and archived on DARS's YouTube channel for the benefit of those who couldn't join us today. So I will send that link out to anybody who needs it as soon as I have it. All right, and with that, I will turn it over to Susan. And Susan, I'll go ahead and advance the slides for you.
Great, thanks. Good afternoon, everybody. So happy we finally were able to get this meeting going. I have to tell you, I just recently moved. This is the first time I've tried to do any kind of a video event from my new place, and the heater, which is very loud, gas heater, is right behind me. You could see the louvered door, and it just decided to come on. So I tried to turn it off, and I think it'll stop blowing in a minute. And I'm afraid that's probably drowning me out right now. There we go. And then the other thing that I need to tell you is that my supervisor, whose name is Oliver, has decided to be very interested today in my desk and my video camera and may or may not join us. So if you see him walk by, he's by a cat. He's very curious. And we call him the inspector. He may decide to walk by. So we'll see what happens. So when I was asked to do this presentation, what I was asked to do was talk about Medicare savings plans, but also Medicaid covered groups. And it's really difficult to talk about the Medicare savings programs. I don't know what I just said, Medicare savings programs, without covering all of the other covered groups first. And as we go through this presentation, I think that'll make sense. So we're going to talk about a little bit of an overview of eligibility requirements for Medicaid, one of which is a person must be in a covered group for Medicaid. And then the hierarchy of how an eligibility worker decides which covered group to evaluate somebody in. Sometimes they actually need to do more than one evaluation. And again, I think some of that will become a little bit more apparent. This may feel like a little bit more information, a little bit more detail than maybe you would like at this point. But because there's a very prescribed, exacting way that an eligibility worker has to evaluate eligibility, and sometimes it doesn't make a lot of sense to people outside of that realm, I wanted to just at least give you the process. We're probably not going to spend a lot of time on necessarily all of the slides, but it can be especially difficult for evaluating children, for example, if any of you are working with youth who are transitioning. So I just really wanted to cover it, even though it may feel like it's a little bit more than you wanted to know. So Michael, we just can get going. Okay. I think we skipped one. So the
There you go.
key overarching principle is that the eligibility determination process is an evaluation, and the eligibility worker looks at an individual situation and their circumstances in comparison to an established standard or definition. And the rules, the eligibility rules that we use come from a couple of different places. For for folks who have a disability or who are over 65, we use the same eligibility rules that the SSI program uses, Supplemental Security Income. So a lot of you are probably pretty familiar with those. For other people, we might use a different set of rules. We might use something called modified adjusted gross income rules, which are loosely kind of based on the Internal Revenue Service, IRS tax rules. And then for other people, we might use yet a different set of eligibility rules. And sometimes we use a blend of all of them. So it is a lot for an eligibility worker to have to know. And the other key part of this is that the applicant has the right to be informed of all of the factors that impact their eligibility. So if they, for example, are determined not to be eligible for Medicaid, then the eligibility worker has to tell them exactly why they weren't. And then, of course, the person has a chance to appeal the decision or offer new information that might impact their evaluation. Okay. So the eligibility determinations do follow a prescribed sequence. And it makes sense because you have to meet all of the eligibility requirements. At least it makes the way I think about it. So if you don't meet, for example, a covered group for Medicaid, it really doesn't matter if you meet any of the other requirements. Because we now have the Medicaid expansion, that has it opened things up to the point where just about everyone will now meet a covered group. Doesn't mean they'll be eligible in a covered group, but they at least meet one. So the person has to meet all the non-financial eligibility requirements. If they don't meet all of those, then, and some of those have to do with covered group actually, then we would not even progress to look at their financial situation. Assuming they meet all the non-financial eligibility requirements and they meet a covered group, then we would check to see if their resources are within the resource limit for that covered group, if there is one, because some of our covered groups don't have a resource test. So we don't care about resources for some covered groups. If the person does meet the resource test or there isn't a resource test, then we go on to see if their income is within the income limit for their covered group. And then we have some other requirements regarding resources for people that need long-term care services, which would be either waiver services in the community or care in a medical facility or other type of institutional facility setting. Okay. So again, we're not going to spend a whole lot of time on these, but the non-financial requirements that everybody has to meet are being legally present in the United States and either being a citizen of the US or being having an immigration status, which we still call alien status based on federal terms. That would be covered by Medicaid, because some people have an immigration status that doesn't allow us to cover them. So for people who aren't legally present and or don't have have what we call a full benefit immigration status, Medicaid does have the ability to cover just emergency services, emergency medical services for those people. We're definitely not getting into that today, but I'm always available to answer questions about immigration status and how it impacts Medicaid. And our contact information is in this presentation. So, the person also has to be a resident of Virginia. That sounds, obvious, but sometimes we get applications for people that don't really meet our criteria for residency. It's pretty, it's not strict particularly. If you live in Virginia and you say you live in Virginia, generally accept your statement of that. But sometimes we have somebody who physically has an address someplace else. And then we have to look at, do they really live here? Do they live in the other place? So that's residency. Everyone has to either give us their social security number or show us that they've applied for a social security number. They don't have to show us their card. They just have to give us the number. And again, if a person is not legally present and they don't have a social security number, then they could still be covered for emergency medical services. The assignment of rights and the application, or let me start with that. The assignment of rights has to do with assigning rights to medical support. So if, for instance, I've been in an accident and I might get a settlement related to the accident, I might be required to assign my rights to that over to the state to help pay for the cost of my medical care if I've used Medicaid. A person does that just by virtue of signing the application. It's one of the things that they agree to when they sign the application. And speaking of applications, we have a requirement that a person has to apply for other benefits that they've earned the right to receive. So those would be things like Social Security benefits, either disability benefits or retirement benefits, or survivor's benefits, and pensions from jobs that a person might have worked, and perhaps other types of benefits that they might be eligible for. The one that kind of stands out that isn't a requirement is SSI. So we don't actually make a person apply for SSI if they tell us that they have a disability, but they've never applied for any kind of SSI. We would say you need to go find out if you're eligible for Social Security benefits, what we call Title II benefits. But if you don't have a work history, and the only thing you'd probably be eligible for is SSI, then we don't make you apply. And it's just based on some federal regulations about what we can require. And then the last non-financial requirement is that what we call institutional status. And it's just a very big picture. It means that we can't provide Medicaid coverage to people that are in certain types of public institutions, namely if they're incarcerated. We do actually cover for anybody who's eligible, who's otherwise eligible, but incarcerated, we could cover inpatient medical services. So if a person's sent to the hospital, they're incarcerated, they're sent to the hospital, we could actually cover that. And it's a way to fund medical care. Way to fund medical care for that doesn't put the cost onto the criminal justice system. Okay. Starting with the that was non-financial. Starting with the financial review, again, we will look at a resource, do a resource evaluation if the cover group has one. And we'll do an income evaluation of a person's unearned income, such as benefits that they might receive, and earned income. And I'll point out again that SSI is not considered income. In fact, we have a cover group for people that get SSI. We don't even have an income evaluation for them. We accept what Social Security Administration has evaluated for that person. And then if a person does need waiver services or services in a nursing facility, Then we also have a couple of other things we have to look at. One of them is called asset transfer. So we need to evaluate whether somebody might have given away some of their assets, which generally tends to be money or real property, sometimes automobiles, and or if they sold something for less than fair market value. So maybe they sold their real property, but they didn't get what the fair market value is for the property. So, and then we also have to evaluate the value of somebody's home equity. This for people that are single individuals, they're not married, and they don't have a disabled child living with them, then we actually have a home equity limit that a person has to meet to be eligible for the payment of long-term care services. It only applies to long-term care services. And if the person has more than that in their home equity, they have the option of drawing down home equity by, say, getting a home equity loan. So they would maybe pay for some of their long-term care privately. And then when their home equity goes below the limit, then they could then be eligible for Medicaid to cover their long-term care. Next. We lost
Sorry,
Michael.
my screen share is just a little bit behind.
Okay.
Apologize.
I'm just so glad you're doing this for me. It's okay.
There we go.
Great. Okay. So the resource test in a nutshell, there are cover groups that don't have a resource test. And those are the cover groups that are subject to that MAGI, modified adjusted gross income methodology. The other non-MAGI families and children cover groups and are other than our medically needy cover groups, and then children under 18 who need some type of long-term care services do not have a resource test. And we're, again, this maybe should have come after the list of the covered groups, because I just realized that I haven't really explained what the cover groups are yet. So the cover groups that do have a resource test are those for age-blind or disabled individuals, the medically needy cover groups, and we have those for age-blind and disabled individuals, who I'm going to shorten to ABD right now, and families and children's individuals who are we call FNC individuals. So that would be parents and children, and the Medicaid Expansion group, which we call MAGI adults in Virginia. It's called different things in different states. Okay. And then if a person's is 18 or over, they meet one of the families and children cover groups. So for instance, they're a pregnant woman or a MAGI adult, then we might have, I'm sorry, not a MAGI adult. It would be a pregnant woman. We might have to, and they have income of over the income limit for whatever cover group they would meet. Actually, could be a MAGI adult. They just, if their income is too high, they don't meet any other cover group, then, but their income is under 300% of the SSI amount, then they would have a resource test. So we may have to circle back to some of this, but let's go on and we'll talk about, I think the next thing probably is income. Oh, okay. I guess it's on. I guess I just have the slide in there for, because some groups have a resource test and some don't. I've moved since I developed this slideshow. I think literally have lost some of my brain function since then. So I have to think about why I put them where I did. So now we're going to talk about the cover groups finally. There are two classifications of cover groups, and these are based on federal definitions that are mandated for Medicaid. We have what we call the categorically needy covered groups and the medically needy covered groups. Some of the categorically covered needy or the CN covered groups are federally mandated. That means if a state does participate in Medicaid, they have to cover those folks. And examples, and there's actually a chart coming up that tells you what groups they are, but examples would be pregnant women and children. And then some of the groups are the state can opt to cover. Virginia covers a lot of the optional groups, but there are a couple that we don't cover. And that's primarily because we cover other groups that those individuals should fall under. Michael, we're seeing your emails.
Sorry about that. I was trying to close that out. Okay.
Okay, I think that's good now. And then the medically needy covered groups, you may have heard of the term spend down. That has to do with somebody who meets all other Medicaid eligibility requirements, but they have excess income to be eligible. So some groups have this option to meet a spend down, some don't. And again, those are going to be outlined as we go through them. There are two main policy umbrellas that the cover groups fall under. So that goes back to the little graphic of umbrellas that was on the first slide. And I've already mentioned this, I guess, but just one more time. The two umbrellas would be families and children's, which is based on the modified adjusted gross income policy and or the old AFDC policy, which is the program that we had in place for cash assistance for families before the TANF program was implemented. And so we still do have a few carryovers of Medicaid eligibility rules from that old program, AFDC, which I think stands for Aid to Families with Dependent Children. And then the other main policy umbrella is the age blind and or disabled ABD umbrella. And everything is going to fall under one of those two. Each covered group that's under those umbrellas is defined by a specific set of criteria. And among those criteria could be age, a person's disability status, whether or not they're a parent and have a child under 18 living in the home, which we would call a dependent child, not necessarily based on tax dependency, but it's really based on age and that the child is living with the parent. We have groups that are based on Medicare entitlement. Those are the Medicare Savings programs, for example. Okay, next. So an applicant has to be evaluated for all potential covered groups that they might be eligible in, and they're enrolled in the group that is the most beneficial to the client. So we start with groups to see if they're eligible in a group that doesn't have a separate Medicaid financial evaluation, such as the SSI group that I mentioned before, or we have a group for people that are getting auxiliary grants, which is a cash assistance program for people in assisted living facilities. And then we also have some cover groups for people that have protected status, who basically are people that were receiving SSI and lost it for a particular reason. And one of them, which I know that you will encounter a lot, is when a child who's receiving SSI then becomes entitled, as an adult, becomes entitled to a parent's dependent or survivor's Social Security benefit. I think you call it a disabled adult child, and we call it the opposite, which is an adult disabled child for Medicaid purposes. But it's the same group of people, and we have a protected Medicaid group for them. We have one for 1619B. Which is for people that have lost their SSI cash payments due to working. Just saw a chat come up about talking about Medicaid Works. We really aren't going to talk about Medicaid Works today. Tune in next week if you can. On the 16th of December, we're going to do the same presentation that Michael and I did in October, or I think it was October, it might have been September, that covers Medicaid Works really in depth, but we just don't have time today. And we were actually asked to do something kind of different today. So that's what we're doing. Again, we'll evaluate a person in one of these groups that doesn't have a separate Medicaid financial evaluation. They're kind of we call they're the true categorically needy groups. Then we'll look at groups with a financial evaluation that offer full coverage, which sometimes we talk about as a categorically needy non-money payment group, or a medically needy cover group. And then finally, we move on to, if the person is not eligible for full coverage, we look at the groups that offer limited coverage, such as the Medicare Savings programs, which you might be familiar with: QMB, SLMB, SLMB, and QI, and QDWI. Again, we're going to go over what those are, but that's what most people know them as if you've been working with somebody who has that type of coverage. The goal for sequential processing, which is what we're talking about, is always to provide the most robust coverage and the coverage for the longest period of time. So we call it the strongest and longest coverage. Some of our cover groups, for example, for pregnant women, would only cover the woman through the end of her postpartum period. So if a person would be otherwise eligible, in another covered group, then they could maintain that coverage once their postpartum period is over, and that would be the longest coverage that they're eligible for instead of just a limited period of time. Meeting a spend down is a limited type of coverage because the longest it can be good for people in the community is 6 months. And then they have to qualify all over again. So the following slides, now what I'm going to start talking about covers sequential processing from the standpoint of an eligibility worker. So there's going to be some instructions that'll say, evaluate, this, evaluate that. And this is as though I'm training an eligibility worker, which in fact we do, to do the sequential evaluation. And I think it's good though for people that aren't in, actually eligibility workers, but work with people who apply for Medicaid to really know exactly what is happening in an eligibility evaluation. So I kind of left these slides to be, pretty much the same way that we would do them for an eligibility worker. So the FNC, the Families and Children umbrella, which I'm talking about first, and I know that probably most of the people on this call are working with individuals with disabilities. But again, because we do try to offer coverage that's less burdensome so the person doesn't have to provide resource verifications, we will look at families and children's coverage when we can. So that even before we would get to one of our ABD cover groups. And so for children, they fall under the FNC umbrella. And as you can see, we could have 3 different definitions of what a child is depending on the cover group. So we have some cover groups for children under 18. We have cover groups for children under 19. And we have some for individuals under 21 who are, I guess, still considered minors in certain ways. We just, so the term, we do kind of need to know what we're talking about when we use that term. We also cover parents of children under 18 in the home. We cover pregnant women, And then this last bullet, which is other adults who are over 19 but under 65, that's our new Medicaid expansion group. So it's kind of the covered group for people that don't meet any other covered group. To be evaluated for that Magi adult group, the person has to be under 65. They have to be an adult because we have other covered groups if they're not. And they have to not be entitled to Medicare. So as you may be thinking, and may already be familiar with the concept of the Medicaid expansion, we have the ability now to offer coverage to somebody who has a disability, but they're still undergoing a disability determination. So they haven't started drawing Social Security benefits. They haven't become eligible for Medicare, and they haven't been formally determined to have a disability. Then we can offer them coverage in the Medicaid expansion group. Similarly, if a person has had a disability determination, but they're in that waiting period to get Medicare, because depending on their when their entitlement to their Social Security is versus when they apply for it, they may have up to, I think it's 24 months wait after they become entitled to Social Security. But it's not always 24 months for everybody. So that's a whole nother probably training we could do, but, and you may have had that before. So that would be our last group. So the next couple of slides these are sort of your resources. I'm not going to go through them because we're actually covering this otherwise in other slides, but this is what I was talking about with the groups of covered, or the covered groups, whether they're categorically needy and mandatory or optional. So this is just a handy slide that you could print and just tape up on your desk or whatever you want to do with it. It's will tell you kind of everything in one picture. Ready whenever you are. Okay. So to figure out what covered group a person might be in the FNC, again, I want to go through these a little bit faster because I know that this is generally not the group of people that you work with. We're going to look to see if the person meets the definition of a foster care child, adoption assistance child, or a individual under 21 who would be somebody, let's say, that's in some type of residential facility. And if they do, we could evaluate them in that covered group because they don't have a resource test. Children who are receiving Title IV foster care or adoption assistance payments have no separate income test. That's one of those groups I mentioned before that has no separate income test. If they don't meet that, we just literally go down this list. Do they possibly meet the definition of a newborn child? A newborn child for Medicaid purposes is a child that was born to a mother who is covered by Medicaid or at least eligible for Medicaid. They don't have a separate application. So, it's beneficial to enroll them without having to do an eligibility evaluation, at least until they turn 1. So that's why we want to go with that group if we could. Ready to flip slides? Okay. The next group we would look at is to see if they might need long-term care because they have a different set of rules that we have to use with a higher income limit. So for people that wouldn't be income eligible any other way, they have a higher income limit. Okay. If the person doesn't need long-term care, they're not in a waiver, or they haven't been screened and approved for a waiver, then we go on to the other covered groups, which for families and children's, which the main one for children is child under 19. has an income test, income limit's rather high, but and no resource test. We also have a special cover group for former foster care children. But the youth, I guess, has to be under 26. They are no longer in foster care and they aren't eligible in any other cover group. So then we could cover them under this former foster care cover group. And then finally, if they aren't eligible for Medicaid coverage, we would look to see if they're eligible for the FAMOUS program. FAMOUS is a similar program to Medicaid, but it's actually a separate program that's authorized by a different part of federal law. And the income for FAMOUS goes as high as 200% of the federal poverty level. So it generally is for children and families where there's a working parent, for example, and they're going to have some income that's going to be a little higher than the Medicaid limit. Okay. Can't talk about children's coverage without mentioning Plan First. When a parent applies for a child, they have the opportunity to opt them out of evaluation for Plan First, which is our family planning coverage. But some parents would rather that their children at least have that coverage than nothing. So some parents do choose to have their child enrolled in Plan First if they're not eligible for anything else. So Plan First is, again, it's a limited coverage, so it's the last thing we look for or eligibility in. We generally will enroll adults in that, but we can enroll a child in that if the parent wants us to do that. Okay, next. Okay. And for some of our groups of children, we do have this option again for the medically needy spend down or medically needy coverage. You would often see that with a family who has higher income, but maybe their child has been in an accident, has been hospitalized, and had really, really high medical expenses that either maybe their insurance doesn't cover or maybe the family just didn't have insurance. So they could need a spend down because they've got these medical expenses that are higher than their income. And that is an option just for children under 1, children under 18, and the children under 1, again, is what we call the newborns. And that would be when the mother is meets a spend down. The child would also meet it as a child under 1 or a newborn. And then the individuals under 21 that we mentioned before. The children who are in either foster care, adoption assistance, or some kind of a residential facility. Okay, so that's our group of children. And then we also have adult cover groups for families and children. And we do evaluate them in order of this hierarchy. This used to be, before we had the Medicaid expansion, the only adults who could be covered if they didn't have a disability, they were under 65, they either had to be a parent of a child under 18 in the home or pregnant. And that's pretty much all we could cover. So now, of course, with the Medicaid expansion, the person doesn't have to be either of those things. So that has really changed the amount of people that I think we've enrolled 500,000 people since we expanded Medicaid in 2019. So clearly there was a need out there. But first thing we do is look at see if the person's a parent, and then if they're pregnant, then we have a special cover group for people who've been screened and diagnosed for breast or cervical cancer through one of the health department programs it's called Every Woman's Life, but they actually do cover men who've been screened and diagnosed with breast cancer. And that again is a group that's doesn't have a separate financial test. The Every Woman's Life program has the financial test and we just accept it. It's a fairly small cover group. but it's based on a federal requirement. So that we cover. Again, I mentioned that former foster care covered group, also a very small covered group. But there are some kids that has helped while they're getting set up as young adults. They are able to have insurance until they're 26. And that is mirrored on the Affordable Care Act, when a parent's insurance could then cover a child under 26. This gives former foster care kids the same benefit and the same opportunity. Okay. And then finally, last but not least, is for the full coverage groups is the Medicaid expansion, the Magi Adults covered group. And again, that could be people that have a disability, but for whatever reason, as long as they're not getting Medicare and they're not entitled to Medicare, if they're not eligible in another cover group, we can cover them under Magi Adults. Okay, next. We have a covered group for people who've been screened and approved for long-term care services. So again, nursing facility services or waiver services, but their income is too high for any other cover group. So we have a special covered group for them, and the income limit is 300% of SSI, the SSI amount. So it's over $2,000 a month. That will allow many, many people who need long-term care services to qualify. Even though they wouldn't be eligible for Medicaid if they didn't need the long-term care services. Long-term care services are a covered service. So people who are on any of those other full covered groups could still receive long-term care in them. So the way that the best way to think of the 300% of SSI covered group, which is a very clunky name, but that's what we call it, is that they aren't eligible in any other covered group, and they have the income that's under 300% of SSI. So that is the upper absolute income limit for full coverage that we have. Okay. Again, if the person doesn't meet any other covered group, any other full covered group, and they don't have Medicare yet, so they're under 65, we're going to evaluate them for Plan First. We have lots of people tell us that they're not interested, they're in their late 50s, and family planning is just really not a need that they have. And so they can opt out of that as well. And I think the next slide, if I'm ready whenever you are, is that one medically needy option we have for adults, and that's for pregnant women. So again, we could have a situation where a pregnant woman has a pretty high income, but maybe she goes into the hospital, she has some kind of complications, she ends up with a really large hospital bill, and she might need a spend down that would at least cover some of that for her. At once she meets the spend down, she could be eligible for a limited period of coverage. Okay, so that was the F&C umbrella. And the ABD umbrella, which is probably what most of you are interested in. We do use some terms that I know are not current terms, but it is what we use. It's what the federal regs use. And that is aged, which means a person's just 65 years or older. Blind, which means that they're determined to have a visual impairment that meets the Social Security Administration definition of blindness, same one that's used for supplemental security income or SSI. Or disabled. So the person has been determined to have a disability by the Social Security Administration or by the Medicaid Disability Determination Services Unit, using the same criteria that Social Security uses. In fact, it is just part of the same agency that does disability determinations for Social Security. And in Virginia, it is actually part of DARS. So it's a unit within DARS. It's done by states, so other states might have it set up differently. But if you live in Virginia, you're going to have your disability determination done by disability determination services at DARS. Okay, next. Okay, so this is that same slide that shows you which are the categorically needy and mandatory covered groups and which aren't. Okay. Okay, so the hierarchy for ABD covered groups is, again, I've covered a lot of this, so I'm just kind of going to whiz through it. I can't see the time, so I'm not really sure how we're doing with it, but so if the person receives SSI or an auxiliary grant, they meet a covered group. We don't have to do a further financial evaluation for them, and that's what we'll enroll them in. If they are a former SSI or AG recipient, we would check to see if they might be what we call a protected individual. And those 3 bullets are the most prevalent or most common protected groups that we come across. There are a couple of others that really no one's in anymore, but because we have one for children that lost their SSI when they changed the definition of disability. They're all over 18 now, so nobody needs that covered group, but it's still in our policy. We can't get rid of it. So, and then we do have an exception. I'm mentioning Medicaid Works. I am mentioning it just for a minute. If a person who has SSI or their 1619B, so they've lost their SSI cash benefit because of working. If they ask us to be enrolled in Medicaid Works, we will go ahead and evaluate for Medicaid Works and enroll them that way so that they get the protections that are offered by Medicaid Works for resources and that higher income limit once they're enrolled. You may, and I just want to stress this because you may come across an eligibility worker, a client that you're working with where the eligibility worker doesn't want to enroll them in Medicaid Works because they still get SSI. We changed that policy a while ago, but I still come across workers that don't realize that. And I'd like to know when you come across that situation so that I can make sure they understand the policy. And that would be true even though we are now in what we call the public health emergency. We're not canceling anybody's Medicaid coverage, but we will enroll them in Medicaid Works if they aren't in a better level of coverage. And if they are in a better level of coverage for some reason, then we will wait until the protected health emergency the public health emergency is over, and then we'll move them in, but we will honor the date that they requested and became eligible for Medicaid Works. So I have come across a few people that had maybe a little bit better level of coverage, they were in a group that didn't have a resource test, for example, which would be the SSI group. And we just know that we have to get them enrolled. The eligibility worker has to enroll them at whatever point that the public health emergency is over. And we don't know when that is yet. Latest I've heard is perhaps April, but we don't know. Okay, so if, and I've already mentioned this a couple of times, if we have a person who's under 65 but has a disability, they'd actually be evaluated in the Magi Adults Cover Group because there's no resource test. So it's really beneficial for them to not have to provide all of that. There's resource verifications, and they might have excess resources even. But since there's no resource test, that doesn't matter. As long as they're under 65 and they aren't entitled to Medicare. So in fact, we have enrolled a lot of people who, in that covered group that were kind of in a limbo situation before we expanded Medicaid. And then the full coverage group we have for people with disabilities is what we call the 80% of FPL covered group. That's just named after the income limit, which is 80% of the federal poverty level. It's a little bit above the SSI amount, not much. And that is before we had the Medicaid expansion. That would have been the only full covered group a person who wasn't getting some kind of long-term care services could be eligible in. That would be kind of the choice after Magi Adults, since that one does have a resource test. Okay. And then number 6, again, is for people that aren't eligible in any other cover groups because of their excess income. As long as they're over 65 or they've had a disability determination, we can evaluate them for that 300% of SSI covered group. And I know a lot of you do work with people in the waivers, and so that might be the group that you're actually the most familiar with. Okay. Now we're going to talk about the MSPs, the Medicare Savings Programs, because I actually was asked to talk about that, but you kind of have to know about all the other cover groups that come before it, because those groups are limited benefit cover groups, and only people who aren't eligible for full coverage are going to be in one of those cover groups. So we have 4 of them: qualified Medicare beneficiary, QMB, special low-income Medicare beneficiary, or SLIMB or SLMB, qualified individuals, which is QI coverage, and then QDWI, qualified disabled and working individual, QDWI. I hope everybody got the handout that was meant to come with this presentation, or you will get it after this presentation. And yes, when we get to the questions, we'll cover what's happening with enrollments right now and cancellations and everything. But you can go on to the next slide. There's a table that I prepared because it just was too detailed to put in a slideshow. You wouldn't have been able to see it. That covers what the Medicare savings programs are, what the 4 of them, what they cover, who's in them, the income limits, the resource limits. They all vary by group. So I'm not going to go through that right now, but that will be in the handout that you have. So once we get through, if they're not eligible, an ABD person's ineligible for Medicaid coverage and full cover benefit cover group, or a Medicare savings program, and they're at least 19 but under 65, then we could evaluate them and plan first. The income limit for that is 200% of the federal poverty level. So it's higher than it is even for the Medicaid expansion group. And we still have a few people covered. And then we do have cover groups for spend down, cover groups for people who are who have disability or over 65. We have those medically needy spend down groups. You often will see someone, if somebody has, I'll just say, if somebody has Medicare, they don't generally need a spend down because they have to have medical expenses that aren't covered by insurance that they still owe, so they're still liable for. And if they have Medicare, they often won't really have enough expenses to need a spend down. Spend downs they're based on a person's income and the income limit, the medically needy income limit for where they live. And a typical spend down could be $3,000. So the person would have to have $3,000, for example, in outstanding medical expenses to meet a spend down. Sometimes they do. They have old bills that they've never been able to pay, and they haven't been written off by the healthcare provider. And they might meet maybe one spend down. So that bill might help them meet the first spend down, but then that bill is exhausted, so to speak. It can't be used again to meet another spend down. So the person might meet one spend down, but not meet any more. The people that tend to meet spend downs are people that don't have Medicare or any other coverage. We are going to cover, or I just mentioned, I guess Medicaid works Oh, okay. We're going to move on to a child with a disability. I know some of you probably are working with transitioning for a youth who might be not quite 19, or they might be, even under 18. So we do things a little bit differently with children. And again, that's kind of why I'm throwing all this at you. Because if things seem like they're being done kind of strangely at the local Department of Social Services, it might be because of this whole hierarchy and sequential processing. So if a child is receiving SSI, they would be enrolled in the, it's an ABD group, but an ABD SSI Medicaid covered group. If you've got a teen who's at least 16, who's requesting Medicaid Works, they're old enough to be in Medicaid Works, and they'd be evaluated that way. And it's good to know that we do have to deem parental resources for their eligibility if the person's under 21, just like similar to the way that that SSI would do it. But we don't have to deem their income. So I don't know of, we don't have too many people on, 16-year-olds in Medicaid Works. I think we have had one or two though. Next. Okay. And for children who are receiving waiver services, generally, or perhaps could be in a nursing facility as well, we can evaluate them in the 300% of SSI covered group. If they're, as long as they're under 19, there's no parental deeming for them. If they're under 18, they don't have to have a disability determination. And that's good because the person might not have ever been eligible, say, for SSI, so they didn't have a disability determination, but they clearly have a medical need that would be a disabling condition if they were to have one. I think it's just that Social Security Administration won't even do them if the parents aren't financially eligible for SSI. We do have to refer the child to disability determination services when shortly before they turn 18, because that's when the ABD rules kick in, and we have to have a resource test for them. So they have to have it actually be determined disabled to be able to continue to get those waiver services without us counting income. I know you might be thinking about the MAGI adults covered group, but if the child is living in the home getting waiver services with the parents for the MAGI adults covered group, and even for the children under 19 cover group, we do have to count the parents' income. So it's very confusing. I will be happy to talk with anyone personally about any of this. It is a lot to try to cover in an hour and a half. And we still just have, again, a little bit more of a sequential processing for a child with a disability. If they are not getting long-term care or waiver services, we'll evaluate them in the F&C child under 19 cover group because it has a higher income limit and no resource test, but we may have to count the parent's income. So that may mean that the child isn't going to be eligible in that cover group. If they are, if they've had a disability determination and they're not eligible when we have to count the parent's income, then we, in the MAGI cover groups, which is the child under 19 cover group with the MAGI rules, then we can evaluate them in that 80% of SSI covered group. But we do have to deem parental income and resources. And I say regardless of what the parent may have been told, because we hear all the time from parents and people that work with families that that because the child has a disability, we don't have to count the parent's income or resources. And if the only group that they could be eligible in is that 80% of SSI cover group, we do have to, in fact, deem those income and resources available to them. The difference is deeming is a little bit different than what we do with the MAGI rules, where we literally just put everybody in the same family unit and fully count the parent's income. With deeming, we do it, I believe it's exactly the same way they do it for SSI, where we would have some allowances for other children in the household, and we would only count part of the parent's income and resources. So it might make a difference in a case like that. Okay, winding up. So the coverage for incarcerated individuals, I don't know if you ever work with anyone who is, you might, I guess at some point have a client who becomes incarcerated for some reason. The person has to meet any of the other cover groups that we have, you know, for Medicaid eligibility, just like anyone else. The difference is that they, if they are eligible in what we call a full benefit cover group, they still have limited benefits. So the only benefit they're going to get is coverage of hospitals, inpatient hospital services. Okay. Sometimes we have somebody who becomes incarcerated that was actually getting limited coverage, and because of their income, or when their income stops because they become incarcerated, they may actually be eligible for full, what we call full coverage Medicaid, but still their benefits are going to be limited just to payment of inpatient hospital services. So I know that's probably really confusing, but I think this is it, and maybe have time for questions. So that's you know, when the person is released, they have an eligibility review to see what their current eligibility will be. So.
Okay, and that was the last slide. We have a question in the chat box regarding the special pandemic emergency period. Somebody asked if that was still in effect. You covered that already. So I will just remind everybody that if you have a question, to put it in the chat box. And while I'm waiting for questions to be typed out, I wanted to remind the VR counselors on the line about 1619B as a billable whistle service, because Susan touched on that a little bit. So if you have a client who needs that Medicaid protection under 1619B and they need help accessing that and putting that into place, keep in mind that that is a billable service that you can refer to a WISA. So for example, say you have a client that's working and you've issued out a work world, and you get a report back that says that the client is earning enough where their SSI is going to zero out, or at least if it's getting close to zero. That's your indicator that 1619B might need to be put into place. And so the procedure code for that is A3008 under the WISA budget and aware. All right, so there's a couple questions coming in now. Just give me 1 minute. I'll see. Beth asked, just to confirm, did you say that the pandemic Medicaid rules will likely go through April? I believe that that's what you said, right, Susan?
Well, I said that at this point, that's our best guess. They are definitely going through through about the third week of January. And we don't know, they don't let us know until usually the day that before they're set to expire, that they're going to be extended. Right now, all we do know is through the end of I want to say it's about the 21st of January. It's all based on that very first time that they were authorized. And so they don't run out, they run in 90-day periods, and they don't end at the end of a calendar month, because that just would make too much sense. So I can never remember the actual day, but it's usually around the 21st.
Okay, and there's another question in here from Erica. She asks, what is the best way to verify this specific type of Medicaid coverage that a beneficiary is getting? I assume that means what covered group?
Well, yes. I mean, well, are full or limited? Are they in the Medicare Savings program? I do understand what you're asking. If the person has their notice of action that they received from the Department of Social Services when they applied for Medicaid, that will tell you what type of coverage they are. They may have lost that, they may not have it. And then in which case they can ask their eligibility worker at their local Department of Social Services. I can check the type of coverage that they have as long as we have the Department of Medical Assistance Services has data sharing agreements. And we do with DARS, but we don't necessarily with the contractors, with the vendors. So it's always a little bit difficult to figure out whether you fall into that. But as long as you have, let's say, authorization from your client to let me talk to you, I can definitely do that. So all you would have to do would be to get the client's permission on a form, whatever form you have. You could email it to me. And I've even been known to just talk to the client on the phone. You can have the client call me. The Medicaid member can call me, which may be actually preferable anyway, if you're working with them on their, what their benefits are. So I do have, the ability to tell. The local departments of social services sometimes can be a little hard to get in touch with. So.
Okay. Let's see. Got a couple more questions that came in. Missy asked, what makes Virginia a 209B state? I had been told it is because there's a rule that doesn't align with SSI rules.
Well, it's a 209B state is a state that it's named for the section of Social Security Act that opts to have more restrictive rules than the SSI program. Remember, I mentioned that we generally follow the SSI eligibility rules for AB.
I'm calling to ask you about Paw Patrol pals. I need.
Hold on, I gotta figure out who's. If somebody's, whoever's speaking, can you please put yourself on mute just to cut down on the background noise? Thank you.
So Virginia has opted to have more restrictive real property requirements than SSI. If you're familiar with SSI, you know that the home and all contiguous property is excluded. In Virginia, we only exclude the first $5,000 of contiguous property. So that's one of the differences. And there are a couple of other ones. We are looking at the possibility of converting and becoming a 1634 state, which is what most of the states do now, where all the person needs to do is apply for SSI. If they're eligible for SSI, then they're going to automatically be enrolled in Medicaid. So this is going to depend on the General Assembly, the budget. Of course, we're going to have a new administration, and I think a lot of new people in the General Assembly. There's really no way to know how that's going to go, but it's something that we have actively been exploring, put it that way.
Okay. Susan, we're past a little past 3:30 now, but if you could you hang on for just a few more minutes? There's a few more questions.
Fine.
Okay.
Yeah.
So going back to the question about data sharing regarding the status of a client's case, someone asks, is there specific language that needs to go on the consent form?
Just needs to say that, I, the member, give you permission to talk to somebody at the Department of Medical Assistance Services about my Medicaid case. And you might want to throw in the at the Department of Social Services also, wherever they live, and then that would actually cover us both. So,
okay. So going back to what you said about data sharing agreements, the ones in place with DARS, but not necessarily external vendors. Someone asks, would you be the person to contact regarding setting up a data sharing contract? Or if not, do you know who would be the right contact?
I'm definitely not the person. But I can, forward it to, it's probably somewhere in our program operations division. So I could forward that. But we also would look at if you might be a vendor for an entity that another type of entity, perhaps, that we do have the ability to share data with, because hospitals, for example, we can share data with their contractors, but it's just really hard because I don't always know what the relationship is between the people that contact me that have some type of a affiliation, I'll put it, with DARS. So I feel more comfortable just getting, honestly, a permission from the member, and that honestly would be just a lot easier than even trying to pursue a formal data sharing agreement.
Okay.
The member really, if the member is able to, can always get that information for themselves. So it's really only if they're not able to for some reason that we would need to talk to somebody else.
Okay, well, we're about 5 minutes over. I'm not seeing any other questions in the chat box at the moment, but Susan's contact information is on the last slide, and I'm sure she'd be happy to answer any questions that weren't covered today. I did see a couple people in the chat box say that they still need a copy of the PowerPoint. I'll take care of getting that to you. That's no problem. And I'll make sure that you have the Medicare Savings Program handout as well.
And I did see a couple of things. I could see the chats just briefly when you submitted them. And I did see a few things that mentioned Medicaid Works. So I just would like to encourage you to tune in. Is it 2:30 next week, Michael, on the 16th?
It's 2 to 3:30.
And it's the 16th?
Yes, that's correct.
So, we're going to cover that. It's a pretty thorough presentation, and I think that might answer a lot of your questions. So again, apologize for just throwing so much at you, but it's just so hard to know, what sometimes if you don't know enough, it might just be even more confusing. But I'd be happy again to talk with anybody, repeat something, just explain it more in depth. If that'll help, and you've got my contact information in the presentation.
Okay,
And
thanks.
I think I just saw that Dave also maybe put it in the chat. So
yes. And so I apologize again for the late start, everybody, but I want to thank the interpreters and Susan for joining us today, and the captioner, and all you guys that took time out of your schedule to participate today. Thank you for joining, and hopefully we'll see you on next Thursday for the presentation on Medicaid Works. Have a great rest of your day, everyone. Bye-bye.
thanks, everybody.
Thank you.